Hi there, it's Tammy here, and in today's short video, I'm going to talk about why I personally don't program and don't recommend training flat on your back during pregnancy, and this is otherwise known as the supine position. Now, the supine position is something that gets contradicted so much on social media, and I also see it all of the time in the gym, pregnant women training on their backs. Now, when it comes to social media, you may even see posts with taglines telling you to stop letting outdated guidelines place you in a box that disempowers you, mama. Or they tell you that these guidelines turn off your power to trust your own body. Now, much of this contradictory information will also tell you to be aware of the signals that your body might send you to communicate that it's time to roll over. These would be things like dizziness or nausea or feeling lightheaded. Now, the reason why you might feel dizzy or nauseous or lightheaded has to do with blood flow, or more specifically, your enlarged uterus compressing a very important large vein called your inferior vena cava, which is responsible for something called venous return, or the return of blood back to your heart from your lower body, right? Now, remembering, your blood is what carries vital oxygen and nutrients to your baby. Your blood flow is literally your baby's lifeblood. So anything that restricts your blood flow affects your baby. And contrary to what social media might tell you, the research on this is clear, and that is just because you can't feel it, it doesn't mean it's not happening internally. In fact, the research actually shows an increase in blood flow through a different vein in order to partially compensate for this decrease in blood flow. And that women who experience the symptoms of dizziness, nausea, and lightheadedness were found to have reduced blood flow in the secondary vein as well. And that's in comparison to those who still had the effects but didn't feel the symptoms. Now, another study also found that resting on your back for just 5 minutes resulted in a 34% reduction in uterine blood flow. And this reduction occurs despite seeing no changes in the mother's blood pressure or heart rate or the baby's heart rate, nothing, no symptoms whatsoever. And interestingly, this study also showed that doing cardio on your back, although there's only one cardio that I know that gets done on your back, and that's how you probably got pregnant in the first place. But whichever cardio they used in this study showed that by increasing the mother's heart rate and blood pressure, the overall reduction in uterine blood flow was only 16% instead of 34%. That's doing cardio on your back, right? But irrespective of the percentages, the research is clear, it couldn't be any clearer, that training on your back during pregnancy will result in the reduction of uterine blood flow, irrespective of whether you are feeling the symptoms or not. And it's for this reason why the guidelines say not to exercise flat on your back after your first trimester. And it's really important to remember that these guidelines are even more important for women who smoke. There are women who are obese and women whose baby is already small for gestational age. And honestly, from my experience over the years, as women get further and further into their pregnancies, some even get symptoms like dizziness or lightheadedness doing simple movements like body weight hip thrusts. And I've even had clients tell me that they've fainted from spending too long in just a slightly reclined position in the car or, at the dentist. So just remember, while it might sound great to tell you not to let the guidelines disempower you during pregnancy, please remember that these guidelines, while subject to change with new research, they are there to keep you and your baby safe. So I encourage you to follow them, but especially when it comes to training on your back during pregnancy. And the reality is, this is actually for a really, really short time. I mean, we're talking from 12 to 16 weeks, and most women stop training around, 36 to 38 weeks. That's 20 weeks, maybe 5 training phases depending on their length. I am pretty sure that you can find safer variations for this small, short window of time. I mean, I know I can. So that's it from me today. I hope this video helped. And if you like this video and want more in-depth pregnancy-specific content, feel free to join my complimentary but private community. The link is in my bio, and I'll see you in my next video.